I'd like to welcome all of you to this briefing on the impact of COVID-19 in the Middle East. I'm Dr. Philippa Whitford. I'm the SNP Health spokesperson at Westminster. I'm a breast cancer surgeon to trade and spent almost a year and a half working in Gaza and Lebanon back in the early 90s, and I'm still involved with a breast cancer project in Gaza. So the whole region, but particularly the situation in Palestine, is very close to my heart. Now we're going to hear from three speakers, which will cover the first half hour, and then we will have a Q&A. If I can ask you to make sure that you're muted if you're not speaking, and when it gets to the question session, if you put your questions, type your questions into the chat, and we will then put them to the appropriate speaker. You don't therefore have to wait till the very end before you start typing your chat. So our first speaker is Brian Whitaker. He is former Middle East editor of The Guardian, and he's been tracking the course of COVID-19 in the Middle East region since the start of the outbreak. Over to you, Brian.
Thank you very much. Yes, you can find the details of the monitoring that I did on my website. There's a link on the homepage. There are lots of things that could be said about this, so I'm just going to focus on a few aspects of it that I found particularly interesting. The first one really relates to the autocratic nature of Arab regimes, because I was curious to see how they would handle a situation like this in comparison with countries with more democratic systems. And initially, the autocrats had some advantages. They were able to take drastic action at an early stage. There were border closures, curfews, internal travel restrictions, things like that. So there was less dithering than we saw in Britain at the time. But what came after that was really huge problems with non-compliance by the public. And the problem is that governments can't deal with the pandemic all on their own. They also need active cooperation with the public. And the relationship between Arab governments and their publics is not really conducive to that. People tend to resent government decrees and instinctively look for ways around them. And social distancing is also a difficult concept in our culture because sociability is very important. And there was a lot of resistance where people were holding illicit wedding parties and that sort of thing. And the cost of this non-compliance could be very high. There was a notorious case of a truck driver in Jordan who had come back from Saudi Arabia. He was given a test on the border, which came back negative. But because of the time lag, he was told to self-isolate at home pending a further test. And he signed a paper agreeing that that was what he would do. The driver then went on, this was during Ramadan, he went on to host an iftar banquet before his second test had been done, and the second test proved positive. And the result of his iftar, at least 90 other people were infected in Jordan. One was a nurse working at the hospital. She was a relative of the driver, and that caused great alarm in the hospital. Another person infected was an ice cream distributor who had passed the virus to a shopkeeper, and that then led to 38 ice cream shops in Jordan all being closed down. I'm not suggesting this was all willful non-compliance, because there were a lot of people who were simply unable to comply because of their financial situation or their living conditions. But I think the compliance problem was exacerbated by our governments, who always like to try and get the impression that everything is under control. And they put a lot of emphasis on visible signs of the government doing things. So in Egypt, for example, you had photos of the Pyramid Plateau being sprayed with disinfectant. In Syria, you had pictures of vehicles driving through pools of disinfectant. So all those kind of visible things. And also, governments made a point of highlighting the number of people who had recovered from the virus alongside the numbers of new infections. And in fact, occasionally in the newspaper, we'd find the first item in the report was the announcement of the number of recoveries. The other thing to note is that where I think in European countries, cooperation is achieved mainly by persuasion and giving information, in the Arab countries there was a heavy reliance on threats of punishment imprisonment, and very large fines. The next thing that I found interesting was concerned with religion. There were a lot of problems in Israel with the ultra-Orthodox Jews, but surprisingly, there seemed less of this in the Arab countries. The Saudis, for example, handled the situation pretty sensibly. They reorganized the Hajj to greatly reduce the numbers, and throughout the region there was closure of mosques, certainly for communal prayer. One exception to this was in Sudan, where the governor of Khartoum was dismissed for refusing to implement a ban on group worship. Technology is a third interesting aspect that I found. What we saw was a huge increase in e-government and e-commerce. And these are really quite important because I think they will continue. And the more e-government you have, the less scope there is for petty corruption involving officials having to bribe them for documents and all that sort of stuff. And obviously with less cash transactions, you have the possibility of less tax evasion and fraud and that sort of thing. What we did see on the technology side, though, was some really scary surveillance, particularly in the Gulf states. In Bahrain and Kuwait, people had been ordered to isolate, had to wear special wristbands to keep them under surveillance. This is a bit like the electronic tagging of offenders that we have here. Under Dubai's lockdown rules, people had to apply online for permit every time they wanted to go shopping. So applicants had to say where they intended to go, at what time they're going, and what time they thought they would come back. And in a further attempt to track illicit movement, the speed cameras in Dubai were adjusted to photograph all vehicles passing them, even if they're not speeding. The last point I just want to raise is about migrant workers, because this is a particular issue in the Gulf states, that there were disproportionate numbers of infections among the migrant workers. It was a sensitive issue and it was generally underreported. But it raised an awful lot of questions about the living conditions of the migrants. There was also a certain kind of discrimination. For example, in Kuwait, citizens who tested positive were sent straight to a state-of-the-art hospital. But non-citizens had to go to a local hospital for assessment. And if you were a non-Kuwaiti man and you weren't seriously ill, you would then be sent to an exhibition centre where there was a field hospital. So there were considerable differences in the treatment there. I'll stop there, I think.
Thank you very much, Brian. I think Philippa has got a call. So this is Chris Doyle. Thank you very much for that. I'm now going to pass on to Yara Asi. Philippa, you're back with us.
I apologize. Just bad timing getting a phone call from the team to explain. I'm in the middle of a meeting. Thanks very much for that, Brian. Obviously, we're coming now to Dr. Yara Asi, who is a postdoctoral scholar at the University of Central Florida, where she's taught in the Department of Health Management and Informatics for 6 years, and her research focuses on global health and development in fragile and conflict-affected populations. And I note that you were the Fulbright Scholar over the last year in the West Bank. So over to you, Yara, and I apologize for that interruption.
Thank you for the introduction. It's a pleasure to be with you, everyone. I'm Dr. Yara Asi, and thank you, of course, to the Council for having me. So depending on where you are in the world today, more than a year after the World Health Organization declared a global pandemic, your experience of this coronavirus is quite variable. So where I am in the US, you could go outside today, and aside from some residual mask wearing, not even that much, you would not notice that much is very different at all than it was in the beginning of 2020. Other parts of the world, however, are experiencing third and fourth waves of infection and are doing quite poorly on vaccination rates. Most of these factors are completely unrelated to an individual's behavior, and they're more so related to factors of governance and economics in each state prior to the onset of the pandemic. So those of you watching this talk are aware of the vast diversity between the nations of the Middle East, from their size to socioeconomic status, level of development, and so on. So today, for the sake of time, as I talk a little bit about the health situation of the region, which is what I'll be focusing on, rather than go through the states one by one, I will talk about them in three relatively loose groupings. So one will be the conflict affected and most fragile states in the region: Yemen, Syria, Iraq, and the occupied Palestinian territories. Two will be the middle income and, let's say, relatively stable nations like Jordan, Lebanon, Tunisia, and Egypt. And three, of course, the high income states of the Gulf like Saudi Arabia, Qatar, and Bahrain. Then I'll end with a broad overview of the challenges the region faces in a post-pandemic world that we hope is coming sooner rather than later. So first, let's start with the region's conflict-affected states. These are, of course, the states that are least equipped to tackle something, a major societal disruption like a pandemic. Their population is already typically at a health deficit because they're poor, they're underserved, they're water and food insecure, and they're generally lacking the components of what we would consider a healthy life. And this can be something as basic as consistent electricity. They're more likely to live in dense urban areas and cramped refugee camps, which makes social distancing impossible. And with high poverty rates, anyone who did have a job could not afford to stay home from work, even if they were sick. Due to limited international travel and movement restrictions, for example, the blockade in Gaza, of course, these countries were among the last to report positive COVID cases. However, we also have to take into account that they also had fewer testing kits, functional laboratories to test the kits, and available health personnel to do all this work. So it's difficult to trust some of the data out of these countries, but as reported, Yemen was the last country in the region to report a COVID case. These countries faced really difficult choices during the pandemic. They had to shift already scarce health resources to treating COVID patients. Of course, other health ailments don't stop in this time. They also understandably report low institutional trust, which reduces their compliance with state mandated recommendations like masks, social distancing. And unfortunately, we're seeing this with vaccine hesitancy in a lot of these countries today. In Iraq, for example, just around 1% of the population is estimated to be vaccinated. These countries will need significant support post-pandemic just to return to a pre-pandemic baseline, let alone to be able to attend to the root causes of their protracted conflicts. So next we'll turn to these middle income states, and these are the most diverse in the region. It's not a perfect grouping, including in their current reality with COVID. Most of these states, surprisingly, were able to get away with only a few cases in the spring, and a few even managed to have a decent summer with only a mild and short first wave as they engaged in strict lockdown measures. Yet by fall, and especially by the past winter, most of these countries were experiencing high infections along with what you don't want to see, which is high hospitalizations and death rates that were straining their healthcare resources. The ministries of health in these states are notoriously underfunded, especially in areas of prevention and health promotion. Funding for health decreases as defense and security spending has continued to increase. This has brought even the most stable of these countries to a really desperate place. Tunisia, for example, despite its level of development, has reported the highest deaths per capita of any country in Africa. Today, we're also seeing significant diversity in terms of vaccination rates. So you look at Jordan, which was also the first country in the world to vaccinate their refugee populations. They've vaccinated 15% of their population. Now compare this to much of Europe and the United States. This is not very high, but let's look at Egypt, on the other hand, which has just vaccinated about 2%. Long term, it will be important to watch how these countries rebuild their health systems as well as their economies, as COVID has really stalled any growth that was happening and increased poverty. We'll also have to watch for democratic backsliding after a year of increasing government control and surveillance. So lastly, let's address these high-income Gulf states and how they fared during the pandemic. So it's no secret that these countries are generally very rich and highly developed with fancy new architecture and modern comforts that aren't seen in many other parts of the region. Yet what may be surprising is that their health systems are not considered high functioning, despite most of these countries offering universal health care to their citizens. Public health investment is actually very low. These populations report very high levels of obesity, high smoking rates, and a lot of indoor activity due to the very high temperatures in the Gulf. These are, of course, ideal conditions for high-risk COVID cases. And indeed, some of these countries, like Bahrain, have reported death rates much higher than their less developed neighbors. When COVID struck, large investments in the health sector were made, but this is the type of situation where preparation is much more effective than quickly trying to make up for lost time, no matter how much money you have. At the same time, oil prices, which bolster the economy of this part of the region, collapsed. Now, I know another speaker will get into the economic effects, but this caused a crisis for the rulers of these states that pulled focus and resources from the simultaneous health crisis that was happening. While the citizens of these countries were able to engage in lockdowns and other measures, the laborers building the infrastructure of these countries, who often live in crowded and unhygienic labor camps outside of the major cities, could not. And it's important, I think, to remember these people when assessing the success, quote unquote, of these countries with vaccination. When it comes to vaccination, these countries are doing extraordinarily well, with most having vaccinated at least half of their populations. And in fact, the UAE specifically has the highest per capita vaccination rate in the world. So I want to end with some broad perspectives. First, regardless of socioeconomic status, COVID has made clear that the health systems across the Middle East are lacking. This is a highly militarized region with high levels of corruption and poor responsiveness to citizens' needs. The benefits of investing in public health are not always immediately clear, which makes them less attractive to leaders on short-term timelines or who are only out for self-enrichment or self-preservation. Yet it will take years for the Middle East to dig its way out of this past year. Another health shock, which is not impossible, as we saw with MERS just a few years ago, would be devastating. A fundamental restructuring of how public funds are spent and what should actually be considered national security is needed. And unfortunately, I'm not sure how realistic that is with the region in its current form. Lastly, this is a region of low institutional trust. We can see this in the vaccine hesitancy being reported across the region. This is an unsustainable state of affairs, as we saw just a decade ago with the Arab Spring and the start of the Syrian civil war. There is significant evidence that rebuilding health infrastructure that actually serves the needs of local populations is a way to build that trust. So I think for those of us outside the region at the moment, how can we leverage this evidence to encourage the region to shift from a national security focus that is dependent on military prowess and an economic focus that is almost entirely dependent on unsustainable oil reserves to one where human security is placed at the center of the state apparatus? These are admittedly tough questions with no easy answer, and this is, of course, not a region that does well with ambiguity. For the sake of the tens of millions of people living across the region, I hope they are able to attain the good governance they need and deserve, and not just for COVID, but the many known and unknown challenges ahead. Thank you.
Thanks very much, Dr. Asi. I think what you highlight is obviously what we've seen in general, this kind of global failure. There was a lot of warm words, certainly here in the UK last spring, about a global response and international response to a global crisis. And, we've seen that utterly. Mostly the conflict or the contrast between different regions, but the Middle East is its own kind of patchwork of differences, as you've highlighted. So, I mean, how we tackle this on a global or regional level is the challenge we face. We're a year in from knowing that vaccines were coming, and our distribution of them is absolutely woeful. Okay, we move now on to our final speaker before the Q&A. Dr. Bessma Momani is a professor of political science at the University of Waterloo in Canada and a senior fellow at the Center for International Governance and Innovation and a non-resident fellow at the Arab Gulf States Institute in Washington. So over to you, Bessma.
Thank you very much. And thank you for the invitation, and really great to be with this wonderful panel. So I guess I'm going to add to the depressing narrative that you've already heard. I think we're really piling on, but it really is the reality. And I think what we've heard already really paints a pretty, dismal picture. And I'm going to add to it with a few more, I think, contexts. One, I'll start with the global sort of macroeconomic situation, because I think, indeed, and as Philippa has noted, certainly I think the global economy is suffering, and there is some positive signs of recovery. The IMF has noted that there will be a GDP recovery, but I think what we can realize increasingly, there's inequities in that recovery, both within countries and globally. And that's really important to keep in mind. Certainly, I think the same economic scarring that we see domestically in the Western countries is certainly found in the Middle Eastern countries. And these are really worrying trends. So first of all, I want to point out that prior to the pandemic, the Middle East, in terms of extreme poverty, was the worst performer. Where everywhere else there was an improvement, this was the one region that continued to falter. And I think this is a really important point, where all other global economic indicators of distribution of wealth, of even socio-political factors like happiness and faith in government has continued to go up globally, but it's gone down in the Middle East. So we're really starting from a very low baseline, and that's really important because I think what I'm going to paint this in terms of a picture that's become full circle is that this is going to also be a political crisis. So it's not just an economic one that we're facing. I think ultimately in the Middle East, it's going to be political. So first of all, what are the implications of all this? Of course, is thinking about what is it going to mean for satisfaction politically? What is it going to mean for the stability of the region? Certainly, I think low oil prices will continue, and that's an important factor, of course, because the region is very dependent on oil revenue, not just the Gulf countries, even countries like the Levant countries, right to Egypt, are very dependent on oil remittances or workers' remittances coming from the oil producing states. That is going to decline, and I think the structural forces there of we're going to travel less. I think this is a reality. We are all, I think, facing new conversations, good conversations about building back better, or about the value of thinking about a more sustainable environmental future. And that all, I think, in my view, portends to seeing less and less use of carbon and less fuels. So I think we are going to see a structural shift in the global economy. That does mean the Middle East, which has as its basic source of income, this very, I think, polluting, source, means that I think globally we are going to see less travel, less dependence on fossil fuels, and that is not good for the Middle East, even though it's good for all of us, globally speaking. So knowing that, that means also, I think, certainly the revenue is going to decrease in many of these countries. And we also know that throughout the region, the small business sector has suffered enormously, just like many countries in the West. Similarly, in the Middle East, small businesses are suffering the most with repeated closures, with insecurity, with the lack of faith in the global or even the domestic economic recovery. All means that there is less and less, I think, variety or diversity in the structure of these economies, which in my view is really terrible for crony capitalism, which means we're going to shift back to, and I think there had been some modest gains in sort of diversifying sources of economic growth in a country and employment opportunity to those small businesses. I think of all the time and effort that more than a decade of international financial institutions and foreign aid has gone into sort of supporting youth with entrepreneurship and small business activity. All of that, I think, is under great risk. And so we're returning to the Middle East of even more crony capitalism, which I think is very terrible for the economic recovery of these countries. As you may all know, the Middle East also depends on a very shallow tax base. So whereas in the West, we sort of depend on income tax, a little bit of corporate and consumption taxes, the Middle East is almost wholly on consumption taxes. That's partly because, there's a lot of cronyism and corruption, and no one wants to claim their income tax. So there's certainly a lot of, I think, mismanagement on government's part here. But the reality is that consumption taxes will mean a more regressive distribution on poor people. We are going to see more of that, raise. And I think as the old adage is of no taxation without representation, that is only going to add to the political frustration on the street of people being taxed further and further. And we even saw in rich countries like Saudi Arabia, a new slew of taxes coming throughout COVID, including value-added taxes, I believe up to 18%. So really quite significant kinds of tax increases. Of course, many of the countries in the region depend on tourism and travel. That is a really important sector. It benefits about 25% of the Egyptian population. Many of them are either lower middle class or even the poor. Everything from small handicrafts to obviously hotels, guides. It really is a very important employment sector. I mean, frankly, I don't see people getting on these kinds of, once in a lifetime journeys to places like Egypt. These are not frequent destinations, with all due respect. It's not like going to the Caribbean, where many of us, we go for, at the drop of a dime, we just go. It's sort of a quick vacation. We know from even Thomas Cook and other sort of travel agencies, these trips to the Middle East, they're sort of like, it takes 5 years to plan. They don't happen overnight. People don't really think of them as a quick stop. It really requires a lot of time and effort. Well, we know the economic recovery in many parts of the Western world, where a lot of the tourists are coming from, is slow. And more importantly, as Yara pointed out really well, is that this is a region that continues to have poor reporting of what are the actual cases. I don't think we can take any of the numbers coming out of the region as trusted. We know that there is certainly high vaccine hesitancy. Certainly seen some numbers that were unbelievably off the charts. 48% of Jordanians have doubts in the vaccine. And so this is going to be a long time before we see this stamped out. And travelers are just not going to go. And the traveler demographic tends to be older that go to these kinds of destinations, once in a lifetime destinations. So I see a real mismatch here, where we're not going to see the tourists go to the Middle East, to these wonderful destinations. And that means less revenue for a lot of these governments and less jobs for the people on the ground. The other thing I was going to point out is that certainly we have a number of countries that are on the brink of failure, Lebanon being the one that I think stands out. It is really literally days away from having the lights off completely, from being unable to import food. 80% of the food that comes into that country is imported. This is a disaster when the currency has absolutely collapsed. No longer any faith in the Lebanese currency, and no one wants to lend. This is the other challenge. And I think we're all facing the rise of populism, nationalism globally. And we see that, and as Philippa noted, this almost hoarding of vaccines. I mean, I think it's really pitiful that in the G7 basically got together to offer 1 billion. I mean, it was really underperforming. And the IMF did some fantastic studies that showed, vaccinate everybody, you will accrue $9 trillion in profit globally. I mean, the math is there. But why didn't we provide? Because clearly we know that there's benefits of a public good to vaccinate everyone. It's because we are facing a more introverted world. I see it in all Western countries. Certainly you folks are seeing it at home as well, which is this, we want to sort of meet the needs of the domestic population first. And so we're vaccinating, frankly, a healthy 15-year-old before we're vaccinating, a vulnerable 80-year-old in the Middle East. That has become what we've done. We've basically put a price tag, a value on life in the Middle East versus in the West. The West is going to have a real hard time recovering. Small, medium enterprises account for 70% of employment in the Western world. I mean, I can tell you also as a small business owner, it's really tough. And around me are complete vacancies throughout, my town here. And I think the same could be replicated across the Western world. It's going to be tough. Similarly, we're looking at job dislocations with digitization. We're seeing retail sectors decimated. Women are the ones that are paying the highest price of this unemployment, and it's across the Western world. So this is all to say there are more needs at home today, and that means people are less generous globally. And we see that in the lack of cooperation, Certainly, I can go into all day of how Trump ruined, global cooperation for this crisis. We can go on and on, but it's the reality. And so that means as these countries go to the international financial institution asking for money, which is the only source to get that money because the international financial markets don't look at them as being safe bets, it's going to be at a high price. And kudos to the IMF for saying that we're not going to impose, a tough conditionality for now. I think those are really great words, but I think when it comes to the reality, we're going to see tough conditions at the end. So I painted a terrible picture for you, and I'll just wrap up quickly and just say, what does that mean for the political situation? Because that's what I think is really worrying. And if you look at the Arab Spring and we think about, and some of us have done a lot of work on this, what brought the Arab Spring? It was often because of the political economic situation, a frustration and lack of faith in governments, which they've proved they're not doing any better under COVID. Certainly lack of jobs, unemployment. The median age throughout the Middle East is about 20. And where unemployment is about, officially in some countries, with the exception of the Gulf, 25% in the general population, it's maybe double, if not triple that amongst young people. So young people are the ones that are paying the price of this recession. They have time on their hands, they're highly educated, cosmopolitan, hyper-connected, and the only thing that I think that really will satisfy them is if they see some political change. So we're looking at, I think, a very short to medium term set of political instability throughout the region. Thank you.
Thank you very much, Bessma. And I think we've seen that in so many conflict areas in the past. If younger people have no sense of hope for their own futures, regardless of what's driving that, then you start to get desperation and people become open to dangerous influences and instability. And I think that is a concern. I mean, coming back to Clinton's comment, it's the economy, stupid. In the end of the day, particularly as we come out of this, and you get past the acute let's all work together and rally round in our community, when people start really hurting in their homes, then the anger will start to build. And as you say, I mean, the G7, the 7 richest countries, offering to eventually give 1 billion doses when we need 15 billion. And, it's estimated that this pandemic is probably going to continue for another 3 years, because it's not just we haven't vaccinated an elderly person in the Middle East, we haven't even vaccinated healthcare workers, So, I mean, we're really failing. I mean, as chair of the vaccine group, this is the thing that has angered me the most. We had such warm rhetoric last year, and we have literally failed utterly. Now, on the same theme of kind of cooperation and so on, the first question that we had in was, probably I would address it to Yara about, is there any possibility that you could create a COVID-19 hub in the Middle East so that you could have a degree of coordination of actions, setting standards of statistics, sharing learning, and particularly looking at, what they did in the EU in kind of purchasing vaccine in bigger quantities and therefore getting better prices and improving distribution. I know everyone mocks the EU, certainly here in the UK, which is, Brexit central. But in actual fact, they did that because the danger would be France and Germany and the UK, if we were still in the EU, would have bought up all the vaccine, and the small European countries and poorer European countries wouldn't have had a look in. So is there any chance, Yara, that you think such a thing could happen? Or are we still really looking at COVAX on a global scale to deliver that?
Yeah, this is a great question. Thanks to whoever asked it. I wish I could, bring the tone up of this conversation a little bit. Unfortunately, the problem with, this level of coordination is it has to be rooted in trust and accountability that exists long before the crisis hits. So to say, a year into the crisis, as the Gulf is emerging and they're trying to get back to normal, and much of the rest of the region, they're all dealing with their all individual pockets of how COVID is doing. the incentives are unfortunately just not there. And this has kind of been, this is the problem with the region. You know, the Middle East is often talked about as like I said in my talk, this monolith, but it, just like any other region, it's a series of individual countries with their own incentive structures. Many are struggling economically. They see cooperation as, you know, ceding sovereignty. You have many of these countries run by authoritarian or authoritarian leaning, at least, politicians, many of whom are corrupt. You know, cooperating on a regional level for a public health, public good, is simply, it would be unprecedented. I think if we can pull anything out of COVID, you know, once we're in a post-pandemic reality, which we're not there yet, as many of us have noted, is that, you know, I hope the lesson is you can't take on these global challenges alone. There needs to be local, regional, and global cooperation on not just health issues, but let's look at climate change. I mean, the Middle East is the region that is first poised to feel the higher temperatures, the lack of water. As Bessma said, you know, they're very reliant on food imports. What happens when food chains are disrupted, food supply chains? These will have to be dealt with on a regional scale. A lot of these countries already share electricity grids. They already share aquifers. They're already able to share resources to some extent, although not without conflict much of the time. How can we build on these pre-existing cooperative steps, along with the hard lessons learned from COVID, that a country by country, you know, way of dealing with it is not effective, no matter how much money you have. I mean, the Gulf lost much more life than you would have anticipated based on how wealthy they are. I hope this is something we see for the next emergency, but we have to plant the seeds of it immediately, if that would be to be the case.
Thanks very much. I mean, I have to say, as a medic, though, you know, the idea that when this is over, people will spend more effort thinking and planning for the next pandemic in 8 or 10 years, instead of actually pulling together in the middle of the crisis, doesn't fill me with hope. The issues around vaccine access, the failure to share intellectual property and technology is so like a rerun of the AIDS crisis in sub-Saharan Africa, and doesn't, as you commented, actually bode terribly well for climate change, where we have to recognize our interdependency. I don't know if Bessma or Brian have any particular points they want to add to that. Brian, you've got your hand up.
Yeah, there will be local production of vaccines in the Middle East fairly soon. Egypt has ambitions to be Africa's biggest vaccine producer. The Moroccans are trying to make Sinovac under license. The Emiratis too. The Iranians are working on, I think, about 5 different vaccines. I don't know how far they've got with it, but that will change the situation somewhat, because the region won't necessarily be totally dependent on supplies coming from outside. That's all I wanted to add to it.
Yeah, no, thanks very much, Brian. I mean, this is the key. I mean, I get dragged onto the media quite a lot, and when you dare to suggest that you're going to send vaccine doses to COVAX, you literally get hit over the head with a mallet. But it's not just about dose sharing right now, which we should be doing because it's urgent, but we should be dealing with helping the global south develop the facilities. You know, this idea that it's some kind of magical secret, people seem to forget AstraZeneca was not a vaccine producer before this crisis, and they managed to get up and running in less than 6 months. So if we did deal with the tech transfer, with the intellectual property, with the data, there are many sites within the global south that could be producing, because we're never going to get to 15 billion with just giving our cast-offs when we feel we don't need them. So it is a real game changer that we need. The next question I have is from Bernie Howley. I'm just going to shorten it and paraphrase it, that he's been in touch with a Syrian refugee in Lebanon who's facing all of the problems you can imagine, all the fears and concerns, but he didn't mention COVID at all. And so Bernie's asking, you know, do you think that actually there are people who are in such extremist and such situations where they're not even thinking about the risk of COVID, and that there isn't that public information there. I don't know who would want to take that, whether it's yourself again, Yara, or Brian, perhaps, because you're actually out there.
Well, I'll just start briefly and say, you know, this doesn't surprise me at all. You know, in a way, when you look at how many of us got through this past year, you know, social distancing is a luxury. Food delivery is a luxury. Being able to work from home with consistent internet, with a functional computer is a luxury. For many of these populations, you know, not only do they not have access to these luxuries, but they're literally, you know, and especially in the case of a Syrian refugee in Lebanon, struggling to make it through the day. I see here in the comments, he has young daughters. You know, there are so many, I mean, it's unfathomable to us, the level of stress and of simply getting food, getting water, finding housing, preventing, you know, discrimination is high against Syrian refugees. I can totally see why COVID would be on the bottom of his list. You know, most of my family is in the West Bank, and in the summer they were sending, you know, pictures of people at weddings and at gatherings, and I was saying, you know, from here my perch in the US, you know, what are you all doing? You're supposed to be social distancing. You know, sometimes they would have a mask on or something, and they were like, I mean, to paraphrase, you know, our lives are so tough. This is the joy that we have, is being with each other, is going to these weddings, is celebrating together. You know, right outside the wedding hall, there's, you know, 10 checkpoints. You can't, I have to, there has to be some value in life. I can't just social distance my way through this, because they have no idea when they're going to be getting vaccinated. And a Syrian refugee in Lebanon is probably on the bottom of the bottom of the bottom of the list. So yeah, this unfortunately doesn't surprise me.
I mean, certainly the team I work with in Gaza, after the recent, you know, airstrikes and so on, they had been working on, you know, lockdowns and various kind of rules around COVID. But of course, under the attack, that all just went completely out the window. I mean, people were displaced, almost 100,000 people, obviously then having to stay in other people's homes, and I mean, Gaza's overcrowded enough at the best of times. But we have, before I move on, see if Brian wants to come in, we have a question anyway to you, which is what you thought of the public health communication. I mean, communication around public health is critical to managing any kind of health crisis. So, you know, how do you think that went in regional states about social distancing, about hand hygiene or mask wearing, or promoting vaccination? To you, Yara, sorry. No, I just thought, as you were on the topic of
Sure.
getting advice, we'd put that one in, and then I'll come to Brian. It's all right, Brian, you can breathe a sigh of relief.
So I'll answer this briefly to leave some time, but you know, like I said, public health investment in these countries is very low, even in the rich states. And what tends to go first when you don't invest highly in public health is health promotion and prevention efforts. So this is not news. I mean, you see high smoking in the region, high obesity, all these lifestyle diseases that we in the West have spent millions of dollars in campaigns trying to mitigate. You know, you just don't see that as much in the Middle East. So I think initially with the first round of lockdowns, because COVID was so new, it was so scary, we had no idea what to expect. It was just this kind of wave across the entire world. Those initial lockdowns, I think, were quite successful. But as people started getting it, as people started recovering, you know, we also have to remember the Middle East is a very young population. They knew they were at least risk for mortality or death. I think that even the best efforts of the state, which are, you know, by no means fantastic, was able to mitigate what people saw with their own eyes. And they just felt like, you know, I might stay home a little bit more. I might wear a mask if I'm indoors, but I'm otherwise not going to be too worried about it because life has to go on.
Okay, thanks, Yara. Brian, just the one that we were talking about, the Syrian refugee in Lebanon, not mentioning COVID, is that a perception you have in, you know, your interactions in the Middle East, that in some areas or some groups of people, it's just not high on the agenda, as Yara was saying.
Yeah, I mean, absolutely. You know, you take somewhere like Yemen, and the things people have to worry about, COVID is pretty low down on their list, to be honest. And I think it's the same in Syria. I don't know, could I just say something about the public health aspects? Because I was looking at the Arab newspapers and things like that, and there was certainly plenty of sound advice about the precautions people were to take, about hand washing and that sort of thing. And there was some quite detailed work done as well. I remember in Qatar, they introduced some rules for hotels to be open. And I mean, it was extraordinary. It went on for pages and pages about all the safety checks and things that had to be made. But the question then is really whether people take much notice of it. And I think people were aware of what they were supposed to do. Some people didn't take it very seriously. And there were a few people in parts of Sudan, for example, who believed it was all a trick by the government, which is, you know, the sort of conspiracy theories that we have going here as well. So there were elements of that. Given how prone the Middle East is to conspiracy theories, I was actually quite surprised that there wasn't more of that.
I think, I mean, as was commented earlier by Yara and Bessma, how critical trust is, you know, and you yourself, Brian, if you have low levels of trust, then obviously that's ripe soil for conspiracy theories. I mean, to be honest, we've had to deal with them a lot in the UK as well. This is probably another one from you, Yara. It's very health orientated, our questions. It's from Salma Hamid asking if there's any accurate data for the different nations regarding the vaccination numbers, both the availability of doses and the numbers administered. I think I have seen that.
Well, there certainly is data. You know, its level of accuracy is a different question, not just because we have to trust the state in many cases to report the numbers, but just because not everyone who is ill is getting tested. Not everyone who wants to get tested can access a test. Not every test can be processed. There's often insufficient health personnel that can do the testing or do the vaccinations. So there's both the logistic difficulties with people getting vaccinated and getting tested and how that works. And then there's also, I think Bessma also mentioned in her talk that you can't trust a lot of the numbers that come from some of these states. Some of them seem much lower than we would anticipate. I expect we won't really know if they're accurate till we can look back retrospectively and do more long-term studies.
And are there any cities? One of the questions is, you know, kind of breaking it down really into some of the cities, because obviously there are very huge cities within the Middle East region. Are some doing better than others, both in controlling it or in vaccination? Do we have that level of granular data at all?
Is that for me as well?
Yeah. For Bessma and Brian, just put your hand up if you've got an answer. They're all terribly medical. I'm sorry.
I don't think so. I think
I think it's, you know, just like many other issues in this region, there's a large urban-rural split in general. You know, a lot of the urban areas, if you've ever been to the Middle East, if you've ever been to Cairo or Amman or Riyadh, these are very crowded areas. So that both lends itself to higher rates of infection, but they also better have the infrastructure to deal with it. So again, not sure if while we're in it at the moment, we can say which cities are doing better than others. Like, for example, I know countries in general, Jordan is doing better than the middle income countries. But as Bessma said, we have states like Lebanon, which you would, you know, similarly economically that are doing much worse because of governance issues. So obviously all the cities in the Gulf are doing just fine. So it really depends, I think, on where you are, and then that pre-existing urban-rural split that exists, not just in the Middle East, but frankly, throughout much of the world.
And do you think the situation in Palestine is likely to improve? Obviously, you know, people have sung the praises of Israel in achieving high vaccination, but yet they haven't taken responsibility for the Palestinian population in the occupied territories. Again, to yourself, Yara, because of your connections. Do you think?
Yeah, I've actually written quite a bit about this since November, because just to save time, I will make my short pitch, which is that Israel remains the occupying power in the territories. This is not superseded by the Oslo Accords, as stated in the Geneva Conventions, and thus Israel maintains its responsibility to vaccinate all Palestinians living under occupation. Vaccinating Palestinians living in Israel is just Israel vaccinating its own citizens, so we should not laud them too much for that. And then, recently there was this report that Israel was going to give the Palestinians 1 million soon to expire vaccines in exchange for a fresh batch of vaccines from Pfizer the PA was going to receive in September, October. It came out that those vaccines were much closer to expiration than it seems that the PA either knew or publicly acknowledged. There's still some questions about that. And regardless, this was not Israel donating 1 million vaccines out of goodwill. This was them merely, like many rich countries are doing, giving away excess vaccines. And then they were going to use the fresh vaccines later for boosters, because Israel is one of the most highly vaccinated countries in the entire world. So I think this is one of the largest human rights issues of this. I think many countries acknowledge Israel as the occupying power and yet have never called on it to fulfill its duties as such, which continue until occupation ends. And I think this is unfortunately just another example where we're seeing that.
I mean, this is when in this sphere, when I'm more talking very specifically about Palestine, if we do not defend international law when it applies to our friends or neighbors or allies, then it will simply not be there when we need it ourselves. And under international law, the position in Israel and Palestine is absolutely clear. Bessma, can I ask you, are there any states within the region that you feel have done a better job to assist those who've lost jobs, or to try and maintain jobs, like the equivalent of furlough and other systems that have been in the richer countries?
Well, I mean, certainly, I mean, as Yara pointed out earlier, that, I think, digitization and the ability to work from home is a big opportunity that has sustained a lot of us in the West. That simply is just not there. The connectivity rates are not there. Well, I should point out the connectivity is pretty decent across the Middle East, but the bandwidth isn't. So the quality of the internet isn't very good. So that means, the usual tools that we're using, Zoom right now and other things, there's just not enough capacity for everybody to go online. So that's a big issue, of course. And I have to point out, to really make it stark, is also, what does that mean for education? So many young people are missing out on a year, possibly 2 years of quality education. I don't think anybody can afford that, let alone the Middle East, which is already in a dire situation socioeconomically. Of course, and I do have to point this out too, is that the gender implications of that, because we already know that there is a preference, and it's not just the Middle East, but frankly, most developing countries will have a preference in families to prioritize boys' access to education and to a computer, which is really important. So we know that. So that'll really, what does that mean for women? I mean, I could go on and on about how this global pandemic, I mean, we've seen the stat here in Canada, just to throw this out because it's just so striking, that we've seen a 30-year retreat in women's participation in the workforce. So we're back to numbers of the 1980s. I mean, all the gains that we made in 30 years have been completely gone, with women being forced to go back to, leaving the workplace and returning to home to assist with education of children and all the rest. So my point is that you can imagine the burdens that are being placed on the family. I want to point out the stress. I mean, I think the stress levels, I mean, Yara probably knows the stats on this better, but the stress levels that, people are facing, and Yara's story of the family, wanting to go have, go to a wedding. I mean, it makes sense, right? I mean, you think about it, that kind of stress, it's on all ends. This is like the only release. So yeah, it's very, very dire. And back to the question of public trust, which at the end of the day, every high-performing country that has done well on all indicators of vaccination, public health regulations, has all been built on trust. And there's no trust in the region. And not only is there a lot of disinformation, so this is really important. Some of that is certainly externally contrived. I mean, I have to put some blame on the Russians, the Chinese. There is disinformation up there that is coming from adversarial states. QAnon, this crazy theory that we think is just in the West, it's in the Middle East as well. It's global. So that's adding to it. A lot of disinformation. And think about this one last thing, the trust that you have to get a vaccine that is brand new, right? So you can also put yourself in their shoes where, the government has never done anything for you in terms of a public good. You feel that at every turn it's tried to undermine you. And so these theories, these conspiracy theories that may seem, far-fetched for us here, but when you don't trust your government, why would you want to give them access to your body and to put in something potentially that has been, frankly, been on the market for a very short period of time? It adds up. I mean, I think we all understand the consequences of this, but this is what happens. And so indeed, it's a perfect storm. And frankly, it's the Middle East people on the ground that are paying the price for it the most.
I mean, that's something that came out in the Vaccination All-Party Group's recent report into how you promote uptake and build confidence in vaccines. And while we often think of, anti-vaxxers or vaccine skepticism as something that's very much in the West or the global North, there is one internet. And, in many parts of the world, you may not have much tech, but you will have a mobile phone. So, in actual fact, a lot of this is everywhere. But there's no counterbalance. There isn't trusted broadcasters. There isn't the same, as you say, trust in government. And so it's very fertile ground. Now we're running out of time. So a kind of last question I want to come to all of you is a question about the WHO. I mean, obviously they are meant to be central. They are the World Health Organization. And while some things maybe weren't as good as they should have been, do you think that in actual fact, their powers to investigate, evaluate, or to, if you like, enforce countries to work together better? Because overall, the biggest failure, whether in the Middle East or anywhere else, is the failure of the international community to treat this as a global crisis and create a global response. So Brian, you've got you're off mute already. So if you want to open, but we're very short, just a wee comment each, please.
Well, the WHO, I worry about it. I mean, look what happened. Syria was brought onto their committee, or whatever it was, this last week or so. I don't have a lot of confidence in it being strong enough to resist political pressures.
So do you think it should be strengthened, or do you think that you need something different?
Well, I mean, it's doing a good job sort of on the information front, compiling figures and giving advice and that sort of thing. But when politics comes into it, I think it really can't sort of stand up for itself. I don't know what you do about that.
Okay, Yara?
Well, I think, it's important to remember the World Health Organization is a body that is led by its member states. So if we don't like what the World Health Organization is doing, we have to look at the powerful structures within it. Just like the UN, you can criticize the UN all day, but ultimately it's a body made up of the whims of its member states. So as a health person, I like the idea of a global body that is meant to deal with exactly what we're going through. But I'm also not naive enough to look back at this past year and say it handled everything perfectly. I'm hopeful that they will learn lessons from this and that states will re-engage with the World Health Organization rather than demonize it as an external entity when it is, again, only enacting what its members want to do. And it ultimately does not have any power to really incentivize or offer, punitive outcomes to member states. It can only offer recommendations, and states can choose what to do with them.
Yeah, I think that's a little bit where we are to some extent with the UN as well. Bessma, over to you.
Yeah, really quick. International organizations never die. This is a fact. NATO post-Cold War survived. The non-aligned movement is still in theory alive. So my point is we have to strengthen it. There's no such thing as break it and then rebuild it. It doesn't work that way. So it's worthy of our investment and time to reform it and make it effective.
Okay, thank you very much. And thanks to all three of you. I think that, we know we need a different society and economy by the end of this decade, or we're going to burn the planet. Our failure to respond to this doesn't bode well for climate change. But I think that it's something that all of us as individuals, parliamentarians, governments have to grapple with. If we don't move forward to a more well-being and fairer approach with sustainability at its heart, we're going to be in big trouble within the next decade. So thank you to our three speakers, to Caabu for organizing it, and for all of you for attending. Thank you very much.